Another topic for this week is clinical approaches based on mindfulness, which is a relatively new intervention approach being used within the pediatric population in the scheme of OT interventions. My own experience with the use of mindfulness is fairly limited, so it was interesting for me personally to familiarize myself more with this topic and the research supporting its use with youth and adolescents. After this week, you should be able to describe the concept of mindfulness, identify what psychosocial outcomes are typically targeted by the use of a mindfulness approach, explain how mindfulness-based approaches can be utilized within OT practice, and briefly summarize the current research regarding the use of mindfulness in the pediatric population. The concept of mindfulness serves as the foundation for mindfulness-based clinical approaches. Mindfulness can be thought of as the awareness that emerges through paying attention on purpose in the present moment and non-judgmentally to the unfolding of an experience. Another definition I came across states that mindfulness is paying attention in a specific, particular way on purpose in the moment and without judgment. From these definitions, hopefully you're hearing the central focus is on improving one's ability to have an internal awareness of themselves. Mindfulness targets emotional regulation and coping processes, as well as improving self-awareness of one's current state. There are several clinical approaches based on the theory of mindfulness, including mindfulness-based stress reduction, mindfulness-based cognitive therapy, dialectic behavior therapy, and acceptance and commitment therapy. Emerging research on the use of mindfulness-based intervention with children suggests that it's beneficial, feasible, and well accepted by youth. But the efficacy of mindfulness on a variety of psychosocial outcomes in children still needs to be researched. Currently, most of the research being done for the use of mindfulness-based approaches is with the adult population, which is showing positive outcomes. Key components of mindfulness includes one's attitude, which should be non-judgmental, accepting, trusting, patient, non-striving, and curious and kind. Attention, which focuses on broad and sustained attention, and intention, which includes conscious intention to practice and directing, sustaining, and switching attention. These three components are intended to be simultaneous and interconnected with the goal of improving self-regulation, behavior, cognition, and acceptance of self. Another important foundational concept is that of metacognition, which is awareness and understanding of one's own thought processes. So now that you have a little background on the basic concepts of mindfulness and metacognition, how do you see these concepts intersecting with OT practice? Before I share some of the populations mindfulness-based approaches have been used with, I'd like you to take a moment to pause and think about what types of clients and occupational concerns might these approaches be relevant for within the pediatric population. Jot down an example of a situation in which you could use mindfulness or metacognitive approaches with a client. I'll give you a minute to do so, and just know that this will be part of one of your online activities for the week. Okay, so as I mentioned earlier, research regarding the use of mindfulness-based approaches with youth and adolescents is in its more infant stages. However, research generally shows that the use of mindfulness is feasible and well accepted by pediatric clients. Preliminary studies have shown that mindfulness has helped to reduce high blood pressure in high school-age students, as well as improve anxiety, depression, and coping in adolescents. Mindfulness-based approaches have also shown benefit in improving executive functioning and attention in younger students. There are several mindfulness-based curriculums, such as the Mindful School curriculum and Mind Up curriculum, which you can find more information about by clicking on the links I provided here for you. In addition, there's a growing body of research that states that mindfulness approaches may be helpful for use with parents of youth, including parents of children with developmental disabilities. In the end, as with many other areas in occupational therapy, more rigorous studies need to be completed to better understand the efficacy of mindfulness with children and youth. There are other practices that incorporate concepts of mindfulness, such as the practice of yoga, meditation, Tai Chi, and Qigong massage. These practices combine mind and body techniques and can be used as part of OT practice. In addition, there are also intervention approaches that specifically target self-regulation skills, which focus on teaching a child how to control or manage their own state. Two common ones that you've already heard about this semester are the Zones of Regulation and the ALERT program, which is also known as How Does Your Engine Run? Both of these programs teach children how to identify their current state of arousal or alertness and how their state impacts others around them, as well as what strategies can be used to help them return to an optimal state. Strategies that may be explored within these programs include cognitive, sensory, and mindfulness strategies. In wrapping up this really brief introduction to the use of mindfulness in the pediatric population, be sure to check out and complete the online activity related to mindfulness this week, which will encourage you to further consider what other populations this approach could be used with, as well as become familiar with some of the research regarding one of the intervention approaches that was shared in the presentation this week. I hope you've enjoyed learning a bit more about mindfulness, as I did, and consider how you can incorporate this into your practice. I also look forward to hearing if any of you regularly practice mindfulness in their day-to-day life, so I can learn more about its benefits and how you can see it helping you as a therapist in the future. Please feel free to email me with any questions or post any lingering questions you may have. Thanks, guys.